We've talked a lot about Obamacare. The focus right now on Obamacare is what are we going to replace it with? That's all anybody wants. It's all the media wants to talk about. Chuck Schumer has claimed it's going to be owned by Republicans. They're going to have to take it. Barack Obama has said it's not. It shouldn't have my name attached to it. Let them fix it if they've got a fix for it. Suddenly they're willing to negotiate on this thing, but big questions still remain. Our guest right now is Dr. Deane Waldman, has published many hundreds of articles about healthcare, has several books about specifically U.S. healthcare, Uproot U.S. healthcare, and dealing with Obamacare specifically in the United States. Dr. Waldman, how are you?
I'm great, thank you.
Thank you for giving me some time today. I loved your article on the alternative to Obamacare and the fact that, in your opinion, we may not need one. Could you explain that to my listeners, please?
Sure. If you go back and just take a look at our healthcare system, which has been sick, I mean, everybody's talking about Obamacare, but the system has been sick for decades. Obamacare, admittedly, made it considerably worse. It's like, I was going to say pouring gasoline on a fire, but the truth is it's poisoning a patient who's already in the ICU. I prefer the medical analogies. Anyway, the point is it's been sick for a long time, and Obamacare made it sicker. And if you stop for a second and say, well, why did it make it sicker? Well, the answer is because it actually helped the condition, the disease that is the reason why the healthcare system is sick. And so once you understand that, which I'll explain in about 10 seconds, once you understand that, then you can say, okay, then the fix, not just for Obamacare, but the fix for the healthcare system is to deal with the root cause of the problem. And the root cause of the problem is federal control of healthcare. The federal bureaucracy is now taking essentially 50% of all healthcare spending produces no care. It is paying for literally trillions of dollars for bureaucracy that isn't being paid to your hospital, to your pharmacist, to your doctor, to your nurse. And my, quote, solution, end quote, is as simple as pie, which is, okay, well, if the problem is the federal bureaucracy, then get the darn federal bureaucracy out of healthcare.
Well, it sounds simple enough. Unfortunately, what they've locked us into here, the 6 years ago, with tax increases kicking in every year,
yeah.
we have to listen to now the poor-mouthing by the left and the media trying to claim that if we just stop Obamacare, it's going to cost us $350 billion. And by cost, it just means that the U.S. might potentially not have that revenue coming in. I mean, it's certainly not a cost to the taxpayers. It's saving them money.
Yeah, well, forgive me, they're not pointing out that it may reduce federal revenue, but it will massively reduce, A, our tax bills, and B, federal spending.
Right.
They keep talking about whatever suits them rather than saying, well, if we don't have to pay for the risk corridors, that's $800 billion. That's almost $1 trillion in insurance bailouts. So when you start saying, oh, well, we're going to lose 350, I'm going, yeah, but you're going to gain 800. So isn't that a good thing?
Well, I would think so.
Not if your primary purpose is control.
That's a good point. So let's assume that the Senate and the House vote to get rid of Obamacare and get rid of the taxes that came along with it. Your suggestion, that I'm sure the people on the left think is radical somehow, is to let the states deal with this, and it's a much more effective solution.
Yeah, I mean, of course, Washington is going to be, and I'm sorry to say both sides of the aisle are going to be opposed to what I'm proposing, which is, hey, let the states take care of their people. It's not your business, Washington, to tell Texas or Florida or California what to do with its people. And by the way, since they're spending almost $3 trillion a year on health care, And then people say, well, the states can't afford it. I'll go, oh, well, wait a minute. What if the feds reduce the states' tax burden by the amount they're now spending on health care and let us spend it on health care? In other words, let us keep our own money.
Well, what you would end up with, I mean, quite frankly, it might be no. I'm not asking you to comment on this, but it might be no different than the marriage equality situation. If it was a state-by-state issue and you didn't agree with the state you lived in, you could always move. I'm assuming in this case you could buy health care across state lines if you liked the plan in Indiana better than you liked the plan in Missouri.
No. Yes,
right?
Exactly right. As a matter of fact, one of the things people are saying, well, what are we going to do with all the stuff that Obamacare built? How about the health exchanges? Well, I'd like them to go back and, we spent, several $100 billion just creating health. As a doctor, it makes me nauseous because I think of how many people I take care of children with heart disease. I could cure every child in the United States with congenital heart disease for the amount of money we spend on the health exchanges. Anyway, well, they're there now. Well, let's let them go back to being what they were supposed to be, which was basically marketplaces, Walmarts, CVS. In other words, lots of different brand names sitting out there, and you walk into the store and you say, I want that, but that's a little expensive. That's the brand name. I'm going to get the generic, and so I'm going to buy this. And what I suggest, and I'm getting to answer what you just said a second ago, is, okay, take Minnesota. I like it as an example. All the surrounding states did not create health exchanges, but Minnesota did. Okay, well, what if Minnesota says, okay, we're going to have a regional health insurance marketplace, and Nebraska and the Dakotas and Wisconsin can simply, people from Wisconsin, Minnesota, and so forth, can buy insurance just as Minnesotans can, and let them compete.
Yeah.
For any, you only want catastrophic insurance, and you want the low premium you'll get with that, fine, you buy that. Oh, well, you want all this fancy stuff with every benefit you can name. You're probably young, so this doesn't apply to you, but my wife and I are both over 70, and yet we have maternity benefits mandated by, I said to my wife, hey, Mayor, and she said, don't you look at me that way. Hey, we got children. The coverage. I'm ready to have another one, but, she's not. Anyway, the point is, why am I paying for maternity benefits? Yeah. I don't want them. I don't need them. Prenatal care is in my package right now, mandated by... Anyway, I want to give the consumers... I don't like the word consumer. I'd rather talk about patients, because that's who they are. But I'd like to give the consumers the choice to buy what they want, because everybody says, well, the government's paying for it. Come on, the government's paying for it with our money.
Thank you.
I just as soon have us pay for what we want with our money.
Yeah. Dr. Deane Waldman is our guest. He's a pediatric cardiologist, and he's got a website called wecanfixhealthcare.info. I suggest that you go there. You can read up on some of his ideas. Dr. Waldman, looking at the current situation and realizing that they're probably not going to take your suggestion, at least in whole, what alternative do you think we're going to end up with? Have you been able to guess at that?
Yeah. I think the thing I'm hoping, the thing that's at least politically possible and could well happen, is that the federal government will actually allow the states to have true control over their own Medicaid. Now, we're only talking Medicaid at the moment. Medicaid, but it's the 1,600-pound gorilla in the room.
Sure.
Let the states have control of their... Certainly, we in Texas are going to request in the strongest terms a Medicaid block grant, and just simply say, give us a fixed amount of money, including the money that we gave you in individual income tax and corporate taxes that we paid the feds. Well, We want that money back, at least the health care piece of it. And we'll take care of our people. Don't tell us what benefits. Don't tell us who's eligible. Don't tell us how to verify. We'll take care of our people. And whether they do that to every state or they only do it to those of us who will ask for it, and we are going to ask for it, second largest state in the union, what I think is going to happen is they're going to say yes. I think they will. It gives them political cover. It balances the budget a bit. And meanwhile, we'll then show them how a free market can actually work. And what I'm hoping will happen is 2-3 years from now, the other states are going to go, wow, look what they did in Texas. We want a free market in our state, and we'll take care of our people, et cetera, et cetera.
Yeah, well, they're doing a lot of good things in Texas, so I hope what you're expecting there comes to pass. Dr. Deane Waldman's been our guest. His website is wecanfixhealthcare.info. We'll put a link to it up on our website. And you've also got a fairly new book out called Cancer in the American Healthcare System, kind of explaining what we talked about there off the top, that about 50% of healthcare spending doesn't go for healthcare. That's amazing.
Exactly. I wrote this book, by the way. I have to make a plug for it.
Sure.
I wrote this book literally for average Americans, not for other MBAs like me, PhDs, and so forth. The whole point is to get people, all of your readers out there into the dialogue about healthcare instead of just saying, oh, the damn thing is so complex, yeah. I can't possibly understand it, I can't take control of my own future. And that's the left's excuse to continue controlling Americans. And I want Americans to control themselves.
It's a great thought. Dr. Deane Waldman, thanks so much for your expertise on this.
Thank you.
Have a great day.
Okay.
All right.
Care.
Thank you. Great ideas there. Why aren't they listening in Washington, D.C.? There's your solution right there to Obamacare, which now President Obama says, hey, don't link my name to that. Yeah, right.